It's nothing new. The biological response that our cells experience when treated with different penetrating beams of laser wavelengths of light, you get what's called a photobiomodulation. And all that long word means is photo is the laser, the biomodulation is the cellular response at the mitochondrial level to that laser instigating a response. Not much different than what people can relate to, like the big brother photosynthesis with sunlight creating a cell reaction, producing oxygen. So that same photobiomodulational effect has been around a long time.
Right.
It's all around us. So what we're working with is something then that when we treat, for example, for the pain conditions, I'm using this particular handpiece and this fiber optic to work on the area of the body that's in pain.
Right.
But it's not very often that it's just that location.
Exactly.
We're understanding it from a physiology standpoint and anatomical standpoint and a diagnosis standpoint, where everything else is connected, how it's all connected, and where else we need to treat than just where it hurts right here.
Right.
So we focus on a lot of those kind of conditions that are out there using this type of device and that handpiece approach. Now when I treat somebody for a pain condition, wherever it might be, I'm going to start with some standard protocol settings and go into a treatment where the beam is going to start penetrating down into that area that I'm working on, following the pattern of the muscle structure, the pathways of tendons and ligaments and where they attach, how the nerve endings run through that system and where those nerve clusters also attach and may be causing pain, is the focus of how we treat that from an angle and a beam direction to get the best response out of those cells possible. And what happens then is that as the cells are exposed to that laser light, they start to react. And they're like, I got to produce something.
Right.
And so what they do as a response to that laser is they start producing this ATP enzyme reaction process. Based on good old biology 101, down to the core basics of what would be known as the Krebs cycle, which a lot of people are like, oh, I remember that. Yeah, this is the same biological response we're getting. And when the ATP enzyme starts getting produced over and over and over again by the cells due to the laser, then what you're getting right on the response following the ATP is almost like an on switch for all these other reactions. The body starts to produce anti-inflammatory reactions. Pain thresholds start to go into reset mode. Vasodilation starts to increase, filled with tons of nitric oxide flowing into the bloodstream from the ATP enzyme. And nitric oxide in the bloodstream is exactly what your damaged nerve endings require
Right.
to heal and repair.
Right.
Scar tissue starts to become not as keloided and hard and breaks down in a healthy way. Muscle tension, our biggest adversary in all this, that could be layer upon layers on top of your muscle structure and cross-hatched, causing compensation pain,
Right.
is told to let go. Go back to your normal muscle memory positioning, that all this laser is instigating to happen over and over and over again in a good way. And so that's where we start to see, as we go through a treatment care plan process and a whole treatment session, people are experiencing this kind of pain relief over and over and over again. So by the time we're done, we have something measurable to now discuss. How are you feeling? How does this hurt now that it hurt like this before? What does it feel like now? And what are we dealing with as far as maybe some new secondary issues that are coming up along with the primaries? So all this kind of goes into how it works and how we're always talking with people every step of the way to make sure that we're adjusting this, tweaking it, making sure that it's fine-tuned for their healing response mechanism, so we're getting the best care plan response as we go through.
Right. So there's a lot of information that went into this. So think of yourself as an individual. So somebody comes to you and they're saying, I hurt here. And I think you do a great job working with people about asking questions and trying to get to know what's going on, because as you know, and we talk about quite a bit, is that just because you feel pain here doesn't mean that that's where the problem is.
Right.
And what I like about you and how you work with me and with others is how you walk people through that process. And so you take the time to understand what's going on, and then you take the time to explain that, okay, now this might start to happen. And you preemptively get people ready to understand that, yeah, it feels different, and it might even be uncomfortable, but this is a normal part of the process, because like you said, you're ridding your body of the compensations to get to the root causes. So I realize each person's unique, but what if somebody were to start with you? What could they expect in terms of a time course? And what does that look like for them? How often do you want to meet with them?